I'm not going to be silenced by threats when it comes to speaking out for my patients and for my ability to take care of them and for what's going on in the healthcare system. If I don't speak out, then I lose. I lose my integrity, and I lose my voice, and I lose the opportunity to make a difference.
This is who UnitedHealthcare is going after, and they wonder why everybody hates them. Hey, it's Jordan. I am in Flint, Michigan, East Palestine, Ohio, Tumwa, Iowa. Please support the only independent outlet on the ground covering what the corporate media covers up. Hey, it's Jordan with Status Coup. As the criminal case against Luigi Mangione, the alleged shooter of UnitedHealthcare CEO Brian Thompson, picks back up later this month, Mangione has added to his criminal defense team. At the same time, boy, UnitedHealthcare is going on offense, particularly aggrieved at you on the internet who write, "In Luigi, we trust." First, let me give you the details on who he has added to his defense team. Luigi Mangione's defense team adds death penalty expert in the case of slain UnitedHealthcare CEO. A federal judge in New York on Tuesday appointed a death penalty expert to the defense team of Luigi Mangione. One of the federal charges, murder through the use of a firearm, makes the 26-year-old eligible for the death penalty. That is why I believe the federal charges were brought in to try and go after him for the death penalty. Judge Catherine Parker, in a brief order Tuesday, approved the appointment of Avraham Markowitz, an expert in capital cases. Mangione's retained counsel, Karen Friedman Agnifilo, is his lead attorney. Quote, "The Agnifilo in-trader team is pleased to have Avi Moskowitz lend his considerable expertise in death penalty cases to Mr. Mangione's federal case as learned counsel. The charges could not be more serious, and our client needs every resource at his disposal to fight these unprecedented charges in 3 jurisdictions," a spokesperson for his defense team wrote. Mangione's pleaded not guilty to the 11 charges in the indictment, including first-degree murder. I know there's a lot of news going on, so you might have forgotten that in January, as the case was moving along, both Mangione's defense team and the prosecution both agreed to basically delay it towards end of February. It could get delayed again. You would think on the government side, if they had the goods, if they had him dead to rights, particularly on the terrorism charge, they would not agree to a delay. So very interesting that they agreed in the first place. But his team is adding this death penalty expert because I think it is a massive overreach to try and go after Luigi Mangione for the death penalty, to add terrorism charges when, as we've shown you, not a lot of folks seem terrorized by what he allegedly did. I also want to show you, it seems that media reporting has led to a increase in Mangione's fundraising. So this was from Newsweek on February 4th, so a few days ago. Luigi Mangione's top donors fizzle out. Large donations to a Give, Send, Go fundraiser created to help Luigi Mangione with his legal fees are slowing down as the contributions total over $228,000. So that was on Tuesday. Newsweek reporting that his donations had slowed down. I guess that reporting led to a surge in donations because the next day, on Wednesday, it went from $228,000 raised to $248,000 raised. So $20,000 increase in 24 hours after Newsweek reported that his fundraiser had slowed down. Mangione's online funds had received over $248,000 in donations to help defend him against state and federal charges. In response to the surge in donations over that 24 hours, Mangione's lead defense attorney, Karen Friedman Agnifilo, said, quote, "Luigi is aware of the fund and very much appreciates the outpouring of support. My client plans on utilizing it to fight all 3 of the unprecedented cases against him." So that is a $20,000 increase in just 24 hours. So positive, and it's Give, Send, Go. Positive for him, I should say. It's a Give, Send, Go fundraiser. Now, UnitedHealthcare, they are not happy. As I reported a few days ago, they are going on a crusade against Dr. Elizabeth Potter. She is the doctor who did the video that ended up going viral that revealed she was rushed out of surgery because UnitedHealthcare had called to try and deny her patient, a breast cancer patient who was mid-surgery, to try and deny her an inpatient hospital stay. Dr. Potter talked about how she had put in for an inpatient hospital stay, and United was haggling her over it, ultimately denied the breast cancer patient in surgery the hospital stay. Well, they hired a very high-powered defamation company to go after her. They wrote her a 7-page gaslighting letter. I did a video on it earlier. I'll put the link in the description if you don't know about it. Basically telling her and trying to tell her what she meant, the type of request she meant to put in, that she incorrectly put in for inpatient hospital stay for the breast cancer patient mid-surgery. It was completely gaslighting. Well, as part of their letter to her, they were not particularly pleased at the comments under her viral video, particularly comments that were pro-Luigi. The first half of the 6-page letter litigated the specifics of Potter's account. The second half focused on the virality of the video and the mean comments underneath it. Oh, poor UnitedHealthcare. Quote, on TikTok alone, the first video generated more than 4.8 million views, approximately 762,000 likes, and approximately 20,000 comments, the letter said. Numerous comments such as, "In Luigi we trust," and "Need more Luigi" were posted in response to your false claims, attempting to justify the assassination of UnitedHealthcare CEO Brian Thompson. So apparently, in an effort to gaslight, intimidate, and threaten the doctor who dared share that UnitedHealthcare had rushed her out of surgery to try and deny a breast cancer patient getting surgery and inpatient overnight hospital stay. In addition to that, they want her to apologize for what folks on the internet said in terms of "In Luigi we trust." Well, let's show you. The doctor did a video explaining the gaslighting letter she got. Let me show you that video.
It's Dr. Potter. United sent me a letter, which I'm going to share in its entirety here, and they denied my patient's overnight stay. I'm going to let their words speak for themselves. What I have to say is that my words were true, and I was honest in my statement in the video. And I'm sure I'll have questions after you read United's letter, and I'm happy to respond to those in some other forum. I'm not going to be silenced by threats when it comes to speaking out for my patients and for my ability to take care of them and for what's going on in the healthcare system. If I don't speak out, then I lose. I lose my integrity, and I lose my voice, and I lose the opportunity to make a difference. And although it is a bit intimidating to have a company like United send a letter like this to me, I know where I stand. I'm a woman taking care of women who are affected by breast cancer. And I know that I do that with all of my heart and in a way that I can be proud of. And I spoke up when I needed to, and I'll keep speaking up. So I would just ask you guys to follow along, share this story and this letter in your communities, because I think that I'm not the only one. And it is scary to stand up against the healthcare system when it's such a wealthy and powerful group of organizations. But it's going to take all of us telling our stories and being honest to make a change. And I am here for it. So yeah, here we go.
So that is the good doctor. Cue the "In Potter we trust" comments. This is who UnitedHealthcare is going after. And they wonder why everybody hates them. And to the point of some people wanting to perpetrate violence. Although I don't condone that, it's a reality. There is a vile, vile hatred against companies like UnitedHealthcare. But United has not stopped at going after the good doctor in their aggrievement over the "In Luigi we trust" comments. They also wrote a letter to the Securities and Exchange Commission over comments that the vile hedge fund manager, Bill Ackman, posted on Twitter. UnitedHealth has reached out to the U.S. Securities and Exchange Commission about billionaire investor Bill Ackman's now deleted post on social media platform X that said he would take a short position in the healthcare conglomerate, meaning he wrote he would basically, if you're trading stocks, bet against UnitedHealthcare. Quote, if I still shorted stocks, I would short UnitedHealthcare, Ackman said in his post, referring to the company's healthcare unit. The investor also said the company's profits are likely overstated due to its coverage decisions. Wow, that must be a crime to tweet out. Bet against UnitedHealthcare. United's shares fell about 1.5% in the afternoon trade after Ackman wrote that social media post. Quote, any claims that health insurers, which typically have low to mid single digit margins, United made $14.4 billion in profits last year, by the way. Any claim that health insurers, which typically have low to mid single digit margins, can somehow over-earn are grossly uninformed about the structure and strong regulatory oversight of the sector, a UnitedHealthcare spokesperson said. SEC declined to comment. So they're going after the good doctor for exposing their predatory for-profit. Get rid of this woman. We're not covering her overnight stay. By the way, I looked into what this surgery was for. Without going into such details, it was not a minor breast cancer surgery. I know some people wrote, well, some cancer surgeries can be outpatient. This was not a minor surgery. She absolutely was correct in requesting an overnight stay, and United denied that. So that's the takeaway there. Not only are they going after her, they're going after hedge fund managers, although he is vile and a Trumper. Suddenly, it's what? Criminal to post on Twitter to bet against UnitedHealthcare. You just can't make this stuff up. They have learned nothing, and they're not even trying to pretend that they're going to reform. They're just going on offense, trying to intimidate doctors, rewrite the narrative. If billionaires say bet against them, they're also in a tussle with a couple different hospitals and health providers in different locations. UnitedHealthcare denial rates and slow payments hamper talks. OHSU says the insurer, this is Oregon, covers 74,000 patients at OHSU and affiliates. Disruption of patient care because of UnitedHealthcare's denial rates and long wait times for payments, quote, remain a sticking point in negotiation with the insurer, Oregon Health and Science University says. OHSU has warned 74,000 patients covered by UnitedHealthcare that they may lose access to OHSU hospitals and clinics unless difficult negotiations result in an agreement before the existing contract. So in English, OHU wants to break relations with UnitedHealth because they're tired of their predatory for-profit vulturism that denies and delays care for patients. So they are essentially going to break any future contracts with them. I'd like to see more health care providers do that. Why are we entering contracts with a murderous for-profit predatory company that is scamming elderly people and seniors with Medicare Advantage, that is deploying AI, which has a 90% error rate to deny claims faster and deny more claims? It's absurd. Not just Oregon, it's also going on in New Jersey. UnitedHealthcare and doctors are at war. A New Jersey woman now faces $1 million in rejected claims. When UnitedHealthcare and a large OBGYN medical practice in New Jersey and Pennsylvania parted ways in April over reimbursement rates, the insurance giant said the dispute would not disrupt coverage for the patients who were in mid-pregnancy or getting cancer treatment. But Axia Women's Health officials claim UnitedHealthcare has reneged on that promise. They say there are about 400 patients who held, quote, continuity of care agreements with UnitedHealth, but collectively were billed $300,000 for deliveries, ultrasounds, and other treatment they expected the insurance company would cover. Quote, all told, Axia has helped file appeals on behalf of 2,300 patients with $1 million in unpaid bills rejected for, quote, out-of-network care. Quote, In the most egregious situations, UnitedHealth's errors and shifting 5,000 or more to individual patients' financial responsibility for services that are covered under continuity of care, Axia Women's Health spokesperson said. As many as 60,000 patients in New Jersey and Pennsylvania lost in-network access to their obstetricians and gynecologists on April 1st when Axia and UnitedHealthcare announced they were at a stalemate over reimbursement rates. To cushion the blow, UnitedHealth informed patients who were pregnant had, quote, newly diagnosed or relapsed cancer or those currently in active cancer treatment may request, oh, how kind, to temporarily maintain their coverage, according to United's website. Kerry Urban of Hasbrook Heights, a 20-year Axia patient with a history of miscarriages, was among those approved for continued coverage. But after undergoing a procedure in April, she received a $4,833 bill anyway, while United paid only $237. Axia confirmed Urban's account, noting UnitedHealth has denied Urban's appeals twice. Quote, I did not go for my 6-month follow-up because of all this, Urban said. I had a quick email conversation with the doctor and decided to wait until my annual exam. I mean, this is just disgusting. Disgusting. And Wall Street is investing in this company, and politicians, including your president, Donald Trump, is doing nothing to rein in, or dare I say, get the Department of Justice to investigate these predators. Trump wants to investigate people in the DOJ and FBI who investigated him, but not the for-profit predators scamming and preying on cancer patients and the elderly. This is making America great. We will continue to report on any updates to Luigi Mangione's case, as well as new developments in UnitedHealth's apparent crusade against doctors who expose them, hedge fund people who bet against them publicly, and others. Please support this reporting, independent reporting, for as low as $5 a month, so we could stay on this important, critical story while the rest of the media has already moved on. StatusCoup.com/join.